Horford Health Centre, Sally speaking.
I have to repeatedly tell myself, there's nothing wrong, there's nothing wrong. What's the point of being alive if you feel like this all the time?
You could do with seeing a podiatrist.
But is my feet smelly?
I'm not going to get there, OK?
No, Ali, tell the truth, because I don't mind.
Not a happy customer.
Life of a 2-year-old.
He actually scratched me just there, but I had to have 2 operations and I couldn't even walk.
My auntie's just died very suddenly of liver cancer. She didn't know that she had it, but she hadn't gone to the doctors. She found out the day before she died.
So it's actually quite a lot to take on all of a sudden.
So how many toes we lost this time?
2.
We've still got 2 left.
Health Centre can help you. Good morning.
Hi, I'm Dr. Cordell. Hello.
Right.
OK. Right, what can I do for your little one?
She was supposed to be in hospital today to have the second part of her surgery for a heart defect because she's a Down syndrome.
OK, yeah. She's had an ASD surgery, is that right?
Yeah, she had the heart surgery last year, but the second part of it was for the leaking valve.
OK.
Because that wasn't successful.
Oh, OK.
So today was the pre-op, but she's been up with a really bad cold over the weekend, as you can see, but it's green snot and she's got a very chesty cough.
OK. So if you slip her jacket off and sit her on your lap, and I'll check her over, all right?
Yes.
So have they given you another date to take her in?
Well, they've said, unfortunately, because it's today, that they was going to cancel for next Tuesday. They said we would like to give her a couple of weeks before we can
Well, I suppose that
see
makes
her
sense,
again.
doesn't
So
it? Yeah.
hoping it'll be 2-3 weeks' time.
Yeah, OK. Seems quite cheerful with it.
Yeah, you loved Daddy, didn't you?
Yes. You've got such a nice smile, haven't you? Let's have a look at your chest first of all. I just want to... Hello. I want to have a look at your breathing pattern. You can have a struggle. Lovely.
Just wait for Daddy, be good.
OK, can we listen to her back?
It's only cold.
OK. Just going to check her temperature. Are you gorgeous? We're just going to check this. OK, that is normal at the moment, actually. OK, so firstly, I think this is just a heavy cold rather than, a nasty chest infection, because her breathing rate's normal, her heart rate's normal, and I can't hear any noises on her lungs, but clearly very, very snotty. Normally speaking, I wouldn't give antibiotics in this situation, but I think this is a slightly higher stakes situation than normal.
Yes.
So, we probably need to be, because we want to get her right for 2 weeks' time, don't we?
Certainly.
So I think we want to pull out the stops and give antibiotics, even if they aren't needed, just in case they are, if you see what I mean.
Yes.
OK. Now, antibiotics do carry some tiny risks, so the commonest thing is diarrhea, of course.
As long as you're happy with that, I'm happy with that.
Yeah,
Mum would be happy, wouldn't she? Eh?
She'll be happy,
She
won't she,
worries,
Mum?
doesn't she?
Yeah, OK, all right.
Thank you so much,
Super.
Doctor.
Nice to see you.
Thank you to see you as well. Come on, okay. All right?
All right, cheers then. Bye-bye.
Have a nice one, Doctor.
OK.
One of the best things in the work that I do is getting to meet and to treat patients like Sophia. It's a terrific privilege to work with people at all stages in their life, helping them to better health.
Nice place here, first time here. Spatial, organized.
We are a very big surgery.
I've been a GP at Hallfield for the last 8 years.
Good morning, Doctor.
Hello.
You look young as ever.
The best thing about being a GP is being able to look after every age group from the first day that somebody's born right through until they're 100 years old or even beyond.
Paul, that was rubbish pulling. Try again. Paul. You can open your eyes now. Brilliant job.
My claim to fame is I'm the longest serving member here at Horfield Health Centre.
Hello, all right?
I've been here for 34 years.
Come on then, let's have your arm.
Which one?
Which is a good one.
I don't know.
I love working with the community that I serve currently. There's a great variation in the kind of patients we see in this practice.
Can I take this out of your mouth?
You're certainly the cutest customer of the day.
I decided to become a doctor at the age of 10.
When did you last see the optician?
Maybe about a month and a half ago, and foolishly I just went, oh, everything's fine, because...
It always happens like that, doesn't it? It's so positive from the start. You come in the morning.
Give me 5.
However busy everyone is, everyone's checking everyone's OK, and it's such a team, supportive atmosphere. Lovely. Thank you for your help. OK, bye-bye.
Hello, how's it going?
Crazy. Leslie Nichols, please.
OK. See you shortly, all right? Cheers. All right. I've had a dreadful 20 hours or so.
Right. What's been happening?
Yesterday, I went to pee. I thought, well, where did all that blood come from? A few hours later, I went to pee again, and there was more blood in it.
OK.
About 2:30 this morning, because I'm a late-night person, I go for my last pee, and it's becoming black. And it's gradually been getting blacker and blacker through the day.
Any burning or stinging when you pass urine?
It's hot.
Any pain in your tummy at all?
It's got some pain right down here.
Shall I just check your temperature? Do you smoke?
I smoke probably a pouch 3 to 4 days. That's about 150.
It's quite a lot, isn't it?
It is.
I think the thing to consider about smoking is it does increase your risk of many diseases.
I do find it extremely frustrating that smoking's being blamed for everything. I'm not justifying it, I'm just saying it. Yeah. You mentioned smoking, and all of a sudden someone says, oh, hang on, it's because... And then you get a lecture where...
OK, I'm not giving you a lecture, I promise.
No.
I'm not a lecturer person.
No, but the thing is...
Oh, sorry. OK, let's have a little feel of your tummy. So if you just lie on the bed for me. Don't worry about your shoes.
I wouldn't get on my bed with my shoes, so I don't expect to get on yours.
I'm just going to have a little feel around. Is that OK?
Yeah.
That's all over there, is it?
Bit, yeah.
Yeah.
The slightly lower you go, the worse it seems to be. There, yeah. Oh, I can feel that pressing on me bladder or whatever. Oh, yeah, worse.
Yeah. OK. You can come back and sit down. Can you go and try and do a urine sample for me now?
It's never going to happen.
Can you try?
Give it a go, but I doubt if it'll happen.
OK, well, let's just try, all right?
All right, cheers.
Right, let's finish these and I'll make a cup of tea. And just get rid of... I hate having piles around me. Not literally piles. So I'll do finish these and I'll make a cup of tea.
Thanks, yeah, no, lovely, yeah.
Yeah.
Oh, hello, come on in.
Right.
Just timed that right, didn't I?
Yeah.
Thank you.
Brilliant.
I've washed my hands.
Yeah, no, that's fine.
And I put it in this paper.
Well done.
So that I don't recontaminate my hands, because it's normally I wouldn't pee over my hands. So I had to wash my hands that way.
Well done. Yep, it is definitely dark, isn't it?
Yeah.
Yeah.
Do you know what? I've been on all morning. I brought my breakfast in and I just realised I didn't even have my breakfast. I'll make up for it later with lots of chocolate.
Oh, good.
Yes.
This is nice.
It's very delicious, Laura.
When I eat carrot cake, usually I think I'm getting at least one of my 5 a day. But it is particularly delicious.
And you eating the same as usual?
I'm eating OK.
But it's not stopping you eat?
No. I like food too much.
OK.
Could I have some of that, and whatever it is, that cake?
No, I've got nuts in it. I can't eat nuts.
Oh.
Crikey, I'll be going funny and I'm just coming up in a rash.
I don't eat that then.
Right, then. How are you keeping?
Well, I'm good to firm and soft in places like my horse is. In the ball of my foot, right?
OK, so you've come about your foot, have you?
No, I just come to see you about ordinary things, about a lot of things. Because this stomach...
OK.
Right, I'd ask you some questions.
OK. I'm just going to slow you down just for a minute.
Go on then.
You choose what the most important thing is, and we'll start with that, and then we'll see how we get on. So what's the most important
now,
thing?
if, the last 4 days, in the ball of my foot, you know, gout, innit?
I don't know if it's gout.
Walk. I can't walk. It's in the ball of my foot, but I don't know whether it's gout or not. I've had a gout about 7 times, yeah?
OK.
Do you want to take your shoe and sock off while I
yeah,
have a quick look? We haven't actually got you down as having gout. Are you sure you've had gout?
I've had gout loads of time because you can't walk with it.
OK. Put your foot on there for me and let me have a little look at it.
Go on then.
OK. Right. Do you look after your feet? Do you cut your toenails?
Yeah.
Right, OK. So
when I put my foot to... It don't hurt when you're pressing it. It's when I put it to the floor.
Right,
No, go up a bit more. Up a bit. There.
Yeah, OK. I don't really think it is gout, actually.
Yeah, but it's gout if I got in the back of the foot and I can't walk because I've had it 8 times, several times.
I don't think it's gout today.
Oh, no, it ain't today. No,
OK.
It'll go red, don't it?
Yeah. You've got some what we call callus, like corns on your foot there. I think that'll probably just get better by itself, all right? Make sure you wear good shoes and everything, all right? OK? You could do with seeing a podiatrist.
A podiatrist. Is my feet smelly?
I'm not going to go there. Okay?
No, Ali, tell the truth, because I don't mind. Because I can't...
Come on, you put your sock back on.
I can't reach me... Honestly,
yes,
I can't reach... I can, honestly.
Try it. Go on, how old are you now? Yes, you can. Go on. Yeah, old enough to get your shit...
Old enough and fat enough, that's why I can't read. I can't... Look, ow.
I mean, that's been getting darker and darker.
OK.
I've never had anything wrong with my waterworks. Not before.
OK. So there's white cells and other what we call nitrates in there that bacteria produce. OK. So it could well be an infection. OK. So what I think we need to do is treat it as an infection. OK. And then come back next week with another sample.
I'm so tired.
Sure. Well, you could be tired from the infection. OK. So we're going to send it off to the lab and treat you now with antibiotics. OK. There we go. So antibiotics 4 times a day.
Oh, I knew it'd be that many.
Yeah. For a week. OK. Lots of drinks, lots of fluids.
Yeah.
If things get worse, either ring us back or ring 111.
All right.
OK? All right?
All right.
OK. All the best then. No problem. All the best.
Thank you for seeing me.
OK, no problem. Bye-bye.
Bye-bye.
What are you like with spiders?
Not a great fan of them. Why, have you got some?
It's all right, it's just one crawling on your desk.
Where?
Sure it is.
Oh, that's OK.
You can,
if it was a little big, fat, hairy one, I wouldn't be keen.
Right. OK. Problem number 2.
Can I have acupuncture? No, seriously.
What for?
No, because I've seen it on telly.
No, you can't
to pump all the fat out.
Oh, I see.
That's what I'm on about.
OK.
Because you can't do it.
Do you want some help with your weight?
How can I do it?
We can give you some healthy advice about keeping active and eating a bit less.
Yeah, but I've got a backache as well. Mine every time I was laying on the carpet and I was...
We're talking about your weight. What's your diet like?
When I go, I was drinking all day.
OK.
Out of cans, because you said it, Mum. You said still taking a pill. And I said, yeah, by the can, Alston pills. Do you get it?
Yeah, I get it.
See?
OK, all right, OK. Do you want me to try and talk to you about your weight?
Oh, go on, then. Yeah, I'm 17.5 stone.
What do you eat? What did you eat yesterday? Can you remember?
All I had yesterday was chicken, and I did have a roast pork sandwich before I went to bed last night.
Do you eat some fruit and vegetables?
I do eat apples, oranges, and all that.
Do you know about having your 5 a day? Do you know what I mean by
I've heard of that. I do have orange and apples. Not apple, I don't like apples.
All right.
I heard something that you can take a tablet in it, and you can...
We very, very, very rarely give tablets, and certainly not before you've tried the normal ways. And obviously, you need to eat healthily and not eat too much. Would you do anything like go to Slimming World?
No, I can't do that.
No, I don't think you would. Would you go?
I could do it with a bad back, man, as well. I was cutting the grass with a flight man.
How much exercise do you do each day?
Well, not a lot, because I'm down on the bed all day.
OK, you're laying on the bed,
yeah, all day.
OK, what I'm going to suggest you do is, right,
have a new back put in.
After the new back's gone in, I want 20 minutes walking.
You're putting a new back, are you?
5 days a week.
Yeah, well, I can.
Don't matter where to.
I ain't got a dog, I've got 6 cats, haven't I? And they taste insufferable. It's true, they do.
All right, OK, you don't have to go with the dog, OK? Just you walking. Could you try and do that?
Yeah, but I can't.
Why not?
Because I can't.
How did you get here?
Well, I walk down here.
OK, that's good.
Because I used to, innit?
OK, just go for a little walk.
I goes everywhere.
That's great. I think that's probably as far as we can go today. All right?
Is it?
Yeah.
Oh, cheers then, Al, mate.
All right, OK.
Good to firm and soft in places.
OK, all right, bye-bye.
Where is Daddy?
You've got big hiccups.
You know, if you drink a lot of water, you're going to need a wee.
OK, how are you?
Oh, well, not that bad, really. I'm just a little...
What a dress, what a dress, eh?
What, you like it, do you?
Yeah, very nice.
I'm a little bit concerned. For the last, 3-4 weeks, I've been getting a niggle in the middle of my shoulder blades.
Oh, yeah.
And I've got it there daily for quite a long time.
Mm-hmm.
What worries me is my mother died of a big coronary when she was, I think, about 62.
Yeah.
My father had angina for years and years and years before he had a coronary, and he died at 74.
Yeah.
And I'm just a little bit concerned that...
It might be something like that. Yeah.
Maybe it could be a bit of angina, I don't know.
OK. And when does it come on?
Well, any time.
Is it when you're doing things or when you're sitting doing nothing? Or...
When I'm sitting doing nothing, I don't do much anyway.
And if you do a bit more, like wash up or potter, bit of pottering you do,
Bit of pottering, yeah.
Does that bring it on?
No.
Do you get any pain round the front? Does it come round at all? I think it's very unlikely to be angina.
Right.
It's a bit unusual where it is. You are probably on quite a lot of stuff that will prevent heart attacks, OK? Because of all your other illnesses, yeah? Let me just have a little feel where it is. Is that all right?
Yeah.
Is it sort of there?
Yeah.
OK. Does it hurt if I press up here? No. Or along the sides here?
No.
And if you do something like stretch, like if you were to go, would that hurt?
No.
Or bring it on?
No, I don't think
No.
so. Not that she's noticed.
OK.
Nothing like that.
I'm pretty certain it's nothing to do with your heart.
No.
So I think we should just wait and see. And you have a think about whether you think it is at all related to exertion, because that would be the key if it was an angina thing. So I think it's more likely to be your other big thing is arthritis. You probably have got some degree of arthritis in your spine, for example. So I think let's give it another 4 weeks, OK? You could keep a little bit of a record as to how often it's happening. People often come in to say that they get a symptom in the year of their parent's death.
Yeah, I suppose I came at 75, he was 74, yes. Oh, what do you mean?
Well, he was 74 and you're 74. That's what I'm thinking.
Yeah. He done this on purpose.
Did he?
He had angina.
Yeah.
And he wanted to be with my mother.
Right.
So every time he had a pain,
yeah,
he deliberately went out and things like that in the street and
to make it worse.
To make it worse.
Oh, dear.
And they took him into French aid several times. And the last time he was took into French aid, he was already dead before they picked him up.
Oh dear.
I mean, that's not going to happen to me. I don't want to go yet.
No. Good.
It ain't like that.
No, glad to hear it.
She's 99.
99. OK, was there anything else today?
No, that's it, thank you.
Okie dokie.
Okie
Well, thank you.
Good, that's all right. Move that a bit nearer.
Yeah, hopefully not worry anyway. Right, thank you very much.
Good.
What a lovely day.
It's gorgeous, isn't it, if you're outside?
We only left Tenerife yesterday. So
Oh, I thought you looked a lovely colour.
It's a bit nippy for me this morning, actually. For me, about 30 degrees is just settling into a nice sort of... It's getting a bit warm kind of thing.
You got your shorts on?
No, not yet.
I was going to say, it's lovely weather.
Yeah.
Hi. All right.
Come on in.
Don't mind my sister coming in.
Not at all, come on in.
Hiya. OK. Over the weekend, I suppose I hit, like, a weird, like, depressed spot where the anxiety is like this constantly. I mean, it's the first time I've left my house in days.
Yeah, I'm sorry to hear that.
She's not sleeping either.
No.
She cannot sleep at all, so that's not... I don't think it's making her any better, not being able to get to sleep. Because
Sure.
when she does, she feels a bit better.
Yeah. So the sleep's one of the problems, the anxiety's a problem. What else has triggered this off, do you think?
I don't know. I must have worked myself up thinking I was going to have a panic attack, and I never did. And then for like 4 nights straight, I haven't been able to sleep. I'm just tossing and turning. I'm grabbing 40 minutes here and there, and that's about it.
So the sleep's a problem. Do you think if we could help with the sleep, that would reduce the anxiety, or is it that you're worrying at night? Which way round do you think is the main problem?
I think it's like I'm full of adrenaline, almost. Like, so I can't sleep, but I don't know what's causing what. I don't know what the roundabouts. What is the main issue?
Sleeping's the main thing that's upsetting you.
Yeah, because I can't go to work.
Because you're too tired?
Yeah,
or because you're too worried?
Because I'm too tired as well, maybe. Maybe I'm working myself up and I'm thinking if I go asleep, then I can go to work. I'm just lucky that I choose my shifts because I think I would have lost my job by now.
Sure.
Which, I don't want to be that
Are you worrying
person.
about things at night? What are you thinking about?
I've got a little bit obsessed with killing myself. I know I'm saying that bluntly, but I think I've cried too much already. But I'm a little bit obsessed with suicide. Not actively going to do it, but then I'm thinking like now I'm at that time in my life where I'm single. I've got sort of like the world at my feet, but now I'm going crazy. Do you know what I mean?
That's quite a major thing to be worrying about, isn't it? Tell me more about it. Have you been thinking about that for a long time, or is it?
Yeah, I'm obsessed with the suspension bridge. But I've never gone there, and every day I plan, I'm just going to go and see what it's like, but I never do it. And then in the back of my mind, it's like, well, why do you want to go and see the bridge? And it's because I know I'm thinking about killing myself, so I stop myself from going to the bridge.
Can I pop this on your finger, Vivian? Can I pop it on your rabbit? Is it a girl or a boy? Girl. Can I pop it on her hand? And then can I pop it on yours?
Yeah. Someone's trying to escape.
Oh, Elliot! No, oh my goodness.
Tip her head back very slightly, Mum.
Open up your mouth for Mummy.
You're not having it, are you?
Oh dear.
You have to be careful.
You're going to come in? No. Oh. Come on, sweetie. We just have to do this really quickly. Joshua. I tell you, we've got a box of interesting toys. Hey, look, what's inside? Let's have a look at this, shall we?
Book to read as well, haven't we?
I'm Dr. Ahmed. Come and take a seat. Look at this. Have you seen one of these? This would be quite old-fashioned, actually, when you're older. What is that? Right. How can I help today?
So he has eczema, but on the back of his leg, he's got quite a severe thing. Let's just show the lady. Yeah, it's only going to be quick.
So at the moment, Mum,
okay, just do this.
What do you wash Joshua in?
So we just use Child's Farm bubble bath.
Okay. And does that keep things at bay?
Yeah, yeah.
Oh dear. Not a happy customer. So, is it only on the back of the legs, Mum?
Yeah, it is.
All right. Let me see all of these.
Look at that.
These are coming back in fashion, I hear.
So yeah, so it's literally only the back of his leg that's
All right.
flared up. The rest of it seems to be all right.
Oh dear. Can I see if we can make it better? We've put some magic cream on it. Oh, that bit's quite flared up, isn't it? And the rest is okay. Okay, well, you're doing really well in managing his eczema. So the more moisturising you do, the better.
Yeah.
You can use Avena during the day.
Yeah.
It might help to have a moisturising wash in the bath, such
Okay.
as oilatum. Something a little bit heavier in the night.
Okay.
It's like a tub of Vaseline. It's called Hydromol.
Okay.
But because it's a little bit... little bit flared up on the back of that knee,
Yeah.
I would just use some hydrocortisone.
Okay.
Just twice a day for about 7 days.
Okay.
You put that on first, and then put the Avena on top.
Okay. Life of a 2-year-old.
Basically. So there'll be 3 things: the bath, the hydrocortisone, and the Hydromol.
Brilliant.
All right?
Thank you ever so much.
No, that was it. It was okay, wasn't it? We don't want you to forget your books, though, do we? Is that all right? Yeah, okay.
Thank you.
Oh, bye.
Thank you.
Do you think that you're at risk of harming yourself?
On the weekend?
On the weekend, yeah, I was.
Why?
Yeah.
What was happening at the weekend that was different?
Because I couldn't sleep and I couldn't get rid of the anxiety. And I have to repeatedly tell myself, there's nothing wrong. There's nothing wrong. I haven't done anything. No one's upset with me. Why am I feeling like this? I get angry with myself that I'm getting anxious. Then I get more anxious, and then I just think, well, what's the point? If what's the point in being alive if you feel like this all the time?
Well, it's horrible, isn't it, feeling anxious all the time?
And then the only reason I did manage to sleep was because I got pissed up. I got drunk, sorry. I got drunk, managed to get myself to pass out. Do you see what I mean?
Yeah.
And then I wake up with a hangover and then I'm
And then
anxious again.
Sure.
Yeah.
And you were on some anti-anxiety medicine in the past.
Yeah.
We last issued that in November, so I suspect that you've run out of that.
Yeah.
Do you think that if we could reduce the anxiety and improve the sleep, that would make you feel better?
Yes,
Okay.
entirely, yeah.
Do you think that would reduce the risk of you feeling about these suicidal thoughts?
Yeah, but I'm hoping, am I going to be okay until it starts working?
Sure, well, this
That's
is
what I
part
don't
of what
like.
I'm
Yeah.
going to check, isn't it? Because, you know, I'm not going to let you go out of here if we're worried that something's going to happen, and I guess that's the next
Yeah.
question, isn't it? Have you made any plans to do something like suicide or go up to the bridge or something like that, or is it just the idea
It's
of
like
it?
a routineful obsession.
Yeah.
And I haven't actively started to do it.
No.
No.
So from that point of view, that reduces the worry about it, doesn't it? Because as long as it's just an idea, then that's horrible, but really common. It's when you start to make plans to do something or you feel like you've got to do that because it's so horrible,
Yeah.
that then becomes the emergency. Do you see
Okay,
the,
yeah.
the-
There
see the
is no
difference?
emergency with me, but I would have said on the weekend, maybe.
Well, I guess that's when we need to tell you what to do if it got worse.
Yeah.
And that would be talking to your sister. I think there's also the Samaritans, and there is the crisis team. Have you heard about them?
Yeah, I know who they are, yeah.
Do you want their phone number?
Yeah.
No, I don't think actually that is
You
going.
throw at me what I can use and I'll take it.
All right, I'm going to give you a course of sleeping tablets to help just get you reset. It's not a long-term thing. I'm going to give a note to the receptionist to make an appointment for me for next week.
Okay.
Because then I've got you in the follow-up plan.
Okay.
All right. I think in terms of the background, the counselling, the self-help through mood gym, which is the online free CBT, and that will help you recognise the negative thought patterns and the positive ones. But I think the important thing is if you get worse, you let us know.
I'll see you next week.
See you next week.
Bye-bye.
Cheers.
Bye.
Bye.
My favourite.
Hello, Mr. Scudder.
How the devil are you?
How the devil are you?
Well, now I've seen you two, I'm bloody
Good.
fine.
And now we've seen you, we're fine too.
Yes. Come to and take a seat. Hi there.
Hello.
Hi, I'm Dr. Thomas. Hello.
He has a high temperature.
Right.
Yesterday.
Right.
And I gave him paracetamol.
Yeah.
Every 4 hours.
Yeah.
But he isn't very well now.
Okay. And any other symptoms? Cold, cough?
He has tummy ache.
Tummy ache.
Yeah, tummy ache.
You've got a tummy
yes.
ache too, have
Yes.
you? And with the tummy pain, is it a bad pain that has he been in a lot of pain with it or not?
No. No.
Okay. So, Shervin, Mum's obviously explained to me about what's going on. Can you tell me how you're feeling, what's been happening? When did you first notice your tummy being sore?
I think it was in the middle of the, like close to morning.
Right. Don't you take your coat off for me, darling? And show me where you've got this pain.
Here and here.
Well, lovely. So it's here and in the back? And
it's the same place, but it's the same place as here.
right. And is it still there now, the pain, or not?
No.
So how long was it there for, roughly, do you think? Do you remember?
5 minutes.
So only 5 minutes and then gone?
Gone.
How long altogether, the pain? Coming, going.
1 hour. I think 1 hour.
Have you got any pain at the moment?
No, I keep getting cold and then get hot, cold and hot.
Right, of course. You're describing things very well, thank you. That's because you've got the temperature, I think. Can I ask you to come over here for me, Shervin? Lie down flat for me, that's brilliant. Okay, now, right, so let's have a little look at you. Can you stick your tongue out for me? Back in again. So tongue looks a little bit white. Does it hurt down here?
It's like taking my breath when you do that.
It's like taking your breath. Okay. If I have a little press in here, does it hurt the back here?
Yes.
So you're tender in your back here. I mean, that's his kidney area a little bit.
Maybe.
Yeah, it is a little bit. I mean, his breath smells a little bit. The tummy's nice and soft, but he seems a little bit tender here. Does that hurt when I press there?
Yes.
It does, darling. Sorry. Okay. Just trying to work out what's going on. Would you be able to do a wee for me?
I don't have a wee right now.
If you can't do it, don't worry, but it'd be really helpful if you could. If you hop off here for me. You can leave your things here if you want. Maybe run the tap or...
Okay.
Yeah?
We come back here.
Yeah, and then come straight back in here, yeah. OK, I'll see you in a mo.
Right, what can I do for you?
I just feel like
all my hands and everything are just swelling up again and getting worse. And all my joints.
Basically, we just phoned up for our bloods and they said that our inflammatory markers were 100. They should be 6. The last bloods was 58. But the treatment nurse said to come and just have it explained to her, what does it mean and what are you looking for?
All right. OK, so we'll need...
You can give me some, not just for the pain, because the medication I've been having, like painkillers, is really upsetting my stomach.
Oh, OK, all right.
So I just want to be treated
for
whatever I got.
OK, all right. We'll go back to the beginning and... OK, because this has been going on for a little bit, hasn't it?
Yeah.
OK, so let's go back to March. On the 13th of March, you were scratched by a cat. Was that the start? Oh, more than scratched.
Well, he actually scratched me just there, but I had to have 2 operations because I woke up with a swollen finger and a bloodshot eye. Okay. And then the following day, everything just swelled up and I couldn't even walk.
OK, so what did they decide was the problem?
Cellulitis.
Cellulitis, OK, so you got an infection. The cat caused the initial opening of the skin, if you like, and then you got an infection.
Yeah.
The cat's in the doghouse.
Yeah.
Right. Can I just look at your hand? Because it's not great, is it?
No.
It's still very swollen.
Yeah.
And what's all this wound from? This is what they did?
This is what they did, yeah.
That whole finger looks very swollen. Has that been like that?
Ever since, yeah.
Ever since. Is it slowly improving?
Not really, no.
OK, all right. So we can account for that joint being swollen, but then what we're saying is that other joints, completely sort of unrelated to this area, are also swelling, and I can see that. So currently, which joints are affected now then?
My elbow, my hands, my knees and my ankles.
So lots of joints.
Yeah.
And you've never had a joint problem before?
No.
No history of arthritis, rheumatoid, nothing like that?
No.
OK. Can you slip your right arm out of that? OK, is that all right? So let's just have a little look now. So this wrist is visibly swollen?
Yeah.
Yeah? OK.
That one all hurts.
That hurts. It's kind of less obvious, but maybe it'd just be less obvious with that joint. But this is, I mean, you've definitely...
This one comes and goes.
This is... Let me just write down. OK, so we're talking about your right, second... shoulders?
Shoulders are fine.
Fine. Knees, you said?
Knees, this one.
Just right knee, so it's all right, really. Sheralyn came in to see me because she had pain and swelling of several joints, particularly her right elbow and wrist. Just prior to having those joint problems, she'd also been scratched by a cat and had unfortunately developed cellulitis, which had required 2 operations and a spell in hospital. But that, in fact, wasn't related to the joint problems. And we now believe that the joint problems were a reactive arthritis following a gut infection that she'd had. Assuming you haven't got a high temperature, then I'm going to give you some steroids now, OK?
OK.
Keep your fingers crossed. No. Excellent. 36.8, completely normal.
Brilliant.
OK, so that's good. What we're doing is we're giving you pregnenolone, which is steroid tablets, OK? You take 3 a day for 3 days. For another 3 days, it's 2 a day.
2 a day.
And then I've given you another 5 days, just 1 a day. OK, so that's 20 tablets in total. All right?
They work.
And I'm going to book you in, I think, to see Dr. Ahmed next week. OK?
So they should start working quite quickly, shouldn't they?
Yes.
Steroids?
Yeah.
Brilliant.
Hopefully within 48 hours.
Yeah. OK, thank you, Doctor.
Lovely.
All right,
Thank you.
thank you so much.
Smashing.
All right, no problem.
Appreciate
Thank you.
it.
Enjoy the rest of your day.
Yeah, thank you.
Bye, Doctor.
OK, bye.
You'll be dancing in 2 days' time then.
Yeah, can't wait.
We managed to do a wee?
Yeah.
Brilliant. Oh, well done, Shervin. That's really brilliant. Thank you so much. That's really helpful. Thank you. That's brilliant that you've done that wee, but it's not helping me in a way. It's not telling me anything. Because what I thought I might find was possible evidence of a urine infection. It's trying to work out what's going on is a little bit tricky because although Shervin's saying about pain in his tummy, actually he's complaining of pain here and here, and he was a bit tender in his kidney area. He's definitely, you know, he's obviously still got quite a high temperature now. Your kidney area? This is where your kidneys are. I probably will send that urine test off anyway.
OK.
Do you feel poorly? Yeah. OK. I'm just going to give them a quick call at the hospital just to speak to the paediatricians about him. Actually, if you want to take a seat in the waiting area and then I'll give you a call back. Is that OK? But just sit outside for me.
OK. Thank you, Doctor.
OK, I'll see you in a mo.
Bye-bye.
Bye. Emergency room, please. I'm a GP.
They got on the weekend, Nick, anything?
I'm meeting some friends for lunch tomorrow.
Oh, that's nice.
But no, I'm decorating because doing.
As you do. Loft?
Yeah.
Yeah.
I've spoken to them at the emergency room and they do want to have a little look at him and see what's going on because we're just wondering whether there's something going on his chest or in your... We want to have a little things checked out a little bit further, OK, lovely? So it means going to the children's hospital. They want you to take the wee with you because you might not be able to go again. So if you put that in your bag to take it and give it to them when you get there. So I'll just copy the letter and then you need to take this with you.
You give me the letter,
Yeah,
yes.
you're going to take it with you.
Okay.
I'll just be 1 minute.
See you, Mr. Scudder.
I'll see you later. Lovely to see you later. I'm being absconded now.
On the bed, or is that easier, or in the chair?
Yes, on the... And let me put my pen away. My sister-in-law just came and she said, "Do you want cottage pie she made?"
Oh, what, for your tea tonight?
I might have it for dinner.
Might have it for dinner.
Well,
Hang on, shall I put the back up for you, Bet? There you go.
well, there you are.
All right.
Lovely.
So have you been keeping
No,
this...
it was a bit wet, she said. They said yesterday.
A bit wet?
Well, I was doing the floor, you see, with my steamer. I think it'd be all right.
I was told it was very wet.
Oh.
Oh. I thought you'd been down Western paddling.
No.
No?
I hope it's all right.
So how many toes we lost this time?
2. So I got 3 left.
You've still got 3 left.
2 left?
2 left. I can't count.
You are. You don't look too bad.
Oh, actually, no, it doesn't look as bad as I thought it was going to.
What's brought you here today?
I have a big lump in my finger. Every time I bend it, it's really hurting.
OK.
Remember when I sliced my finger with the food processor? You can still see the scarlet.
And how many days has it been sore?
2 weeks?
No, it's not 2 weeks.
Yeah.
The next day, I had pins and needles in these fingers. I've still got pins and needles in these fingers now to this day.
OK.
It's been about 10 years ago.
The noise and the jump happens when you're straightening it. Yeah. You need some WD-40, don't you?
I think this now have got so painful. I can't knit anymore, which is my favourite thing.
Yeah.
Come on in, come and take a seat. Thank you. OK, what's on your mind today?
So I had that lump on my finger and you said to come back in a couple of weeks if it hadn't gone down or if it had got worse.
Oh, right, OK, let's have a look at it.
It doesn't look particularly bad, but it's just...
It's just there,
hurting and it's got a bit bigger and it does get quite sore.
Right, OK. And how long do you think it's been there for?
I mean, a few months, probably.
And is it hurting when you move the finger? Are you aware of it?
It's just generally aching. I can feel it now.
OK, because I think what this is, it's one of these cystic things that comes around from one of the tendons.
OK.
So the tendon's like a straw in a straw, but you can get these what we call mucinous cysts. I'm not worried about it.
OK.
Anything else I can help with or anything else that you want to ask?
My auntie's just died, like, very suddenly of liver cancer. She didn't know that she had it. And I started reading about it. And I've been getting twinges in my upper back, and I'm sure it's muscular. I just
That's right. It looked as if you had something on your mind, see? So I'm sorry about that. How old was she?
55.
Quite young, actually.
Yeah.
OK. And when did that happen?
Thursday last week.
Oh, gosh.
Yeah.
Very recent.
Yeah.
Were you close to her?
Yeah. I mean, hadn't seen her for a while because she lived in France, but she hadn't gone to the doctors, and then she found out the day before she died. So it was very sudden.
OK, so that's actually quite a lot to take on all of a sudden. Whereabouts are you getting pain?
Just up, just here. Sometimes it's twinges and sometimes it's aching. I know that I'm just being a hypochondriac.
How long has it been there for?
At least 6 months to a year, and I just thought it was muscular.
And this pain, do you have to take painkillers for it? Does it disturb your sleep?
No, I mean, sometimes it's uncomfortable.
I think that is muscular and I'm not worried about it. But I think what's more important is giving you a bit of support of dealing with your auntie's sort of sudden passing, because that's triggered all sorts of things.
Yeah.
Do you know about CRUISE, the bereavement services? So it's a counselling service. You can phone them and arrange an appointment, which is just to talk through the issues surrounding your auntie's death. And I think that there's a lot there that you're still processing. It's all too new and too raw. I think come back and see me. Let's give it, well, I'll leave it up to you, but I would say at least 3-4 weeks.
OK.
I'll just see how you're getting on. and then we'll look at the back in a little bit more detail, because I think there's a lot more going on. Sometimes these things stay in with us, and if they're not sort of externalised, they go internally and we start worrying about other things. But it's a normal grief reaction. Anything you want to ask?
No, it's all right. Okay, thank you.
That's all right. Take care.
You too.
Bye-bye.
Bye.
Oh, by the way, yes,
Yeah.
I've had 15 years of illness.
Have you?
Quadruple bypass, vascular operations on both legs. Then I had some chest pains and it ended up with, what do they call it, angina. Then my hip started kicking up. I ended up there.
Oh, no.
Waiting for a new hip. And in between that time, in 2007, I went down with leukemia.
I remember that. You were
Remember
lucky.
that?
Yeah, I do.
So, I mean, I've had they said a 7-card trick. I've had the 8-card trick. You know what I mean?
Yeah, you've been very lucky.
I've known Michael for a long, long time, probably about 25 years. He's always been a character. He's always been kind and comes in singing his songs. He's just such a lovely fellow. I really warmed to him.
For 9 years, I was with Shakin' Stevens, playing the piano.
I know, you told me.
Michael is a diabetic, but actually he's quite well controlled. But recently he has had to have 2 of his toes removed due to infection. And unfortunately he had 1 removed last year. If we can't get on top of the infection and things continue to deteriorate, there is always a possibility that he could lose his foot.
It looks better now, Lynn, don't it? You never seen it yesterday?
I didn't see
it. Was like white and all that because it was...
Because it got too wet.
Yeah.
Are they seeing you at the hospital?
No, 3 weeks' time.
They left you in our capable hands, have they?
Well, they said they... round my ankle, my love.
All right, hang on.
All right. I don't want too much on her, because I got a...
Oh, you've got to put your dancing shoes on.
I got a dancing shoes. Right, now a bit of blue on there, that'd be fantastic.
Do you want your toe in or...?
Yeah, my toes, I want my toes in. Yeah, covered up, yeah.
So I want it like a sock, yeah?
Thank you.
It's only a bit extra.
I got you, babe. Oh, that's lovely, that. Look at that. She's bloody magic.
What about this boot? You're going to...
Right, yeah, if you... You don't pull it right out. Just...
No, I'm just going to...
Just... That's it, my love.
Oh, you don't have to nag me.
Oh, all right, then come on. Yeah.
Hang on, pull your trouser leg down. Look.
Anything for you, my love. I'll see you next week, I expect.
Thanks very much for your time.
That's okay.
See you with the results in a couple of weeks, think you?
All right, thank you.
Cheers, bye.
Nice to see you both.
All right, thanks ever so much.
Cheers.
Bye.
So thank you very much. Bye-bye. Bye-bye.
Take care.
See you
Bye then.
soon. Bye.